It's 10:02, so let's go ahead and get this started. Thank you all for coming. Most of you I have spoken to at some point, but if not, my name is Jessica. Jessica Hernandez. I am the director here at the Family Resource Center. So thank you all for coming.
Sorry. I
Today,
know they have on your papers.
today we have Sharon Woolfolk from the National Alliance on Mental Illness, also known as NAMI, as well as Lisette Navarro from the Project Food Box, who is going to be sharing today some valuable information. Our last collaborative was back in May, and it was in person. And thank you to those of you that were able to make it. It was a really nice turnout, and we actually plan on having our next collaborative is going to be in person as well. It'll be in September. I think it's going to be at the high school here in Fraser Park, but I will definitely confirm that in an email in the near future. So with that being said, Sharon, are you ready to present for today?
Yes, I am. And can I share my screen?
You are more than welcome.
Okay. Good morning, everyone.
Good morning.
Good morning. And so, yes, I'm Sharon. I'm with NAMI, the National Alliance on Mental Illness. And just a little bit about myself. I am a retired probation officer. Been retired for about 12 years now. And I've been with NAMI for about 9 years, currently serving as the president. And so what I thought I'd do, just to kind of get you into the idea of what we do and why we do it, I thought I'd start off by sharing just a real brief story, and you may have heard it before. But this young girl was walking along a beach where these thousands of starfish had been washed up during this terrible storm. And when she came to each one of the starfish, she would pick it up and she just threw it back into the ocean. And so the people who were watching her were quite amused. She'd been doing this for quite some time when a man approached her and just said to her, "Little girl, why are you doing this? Look at this beach. You can't possibly save all those starfish. You can't even begin to make a difference." Well, that little girl, she seemed crushed and let down. But after just a few moments, she bent down and she picked up another starfish and hurled it as far as she could into the ocean. And then she looked up at the man and replied, "Well, I made a difference for that one." Well, that old man, he looked at the girl and he thought about what she had done and what she had said, and feeling kind of inspired, he joined that little girl in throwing back the starfish into the sea. And soon all the others joined and all the starfish were saved. And I say that because 1 out of every 5 adults and 1 out of every 6 youth are experiencing or will experience a mental health condition at some point in their life. There are millions of Americans experiencing some mental health challenges, and they're struggling to get the help that they need. NAMI, the National Alliance on Mental Illness, we are a nonprofit organization. Our primary goal is education, educating and supporting those individuals living with mental health challenges. We are the largest mental health organization. We're in all 50 states, including Canada, Italy, and Mexico. All of our services are free and they're offered to anyone who needs support. Again, our whole desire, our whole mission is to make an impact in the community and those individuals who are living with mental health challenges through our awareness and our community engagement. And so NAMI was founded in 1979 by these two women who were caring for sons diagnosed with schizophrenia. And these two moms were simply tired of their sons being blamed for their mental illness. And of course, these two moms, they were not happy because during that time, there was a lack of services and little to no resources for those individuals and families living with mental health challenges. Well, these two moms, they found others with the same concerns, and they formed what is now known as NAMI, the National Alliance on Mental Illness. Again, we are in all 50 states, including Canada, Italy, and Mexico. There are about 1,200 affiliates, or what we call chapters, of the NAMI Foundation or organization. We are, again, individuals. We are family members. We are mental health professionals, all working together for one cause, and that is to make life better for those individuals living with a mental health challenge. Harriet Shetler, one of the co-founders of NAMI, wrote this. I'm just going to simply quote what she said. We're just trying to change one person at a time and society's attitude about mental illness. We're just trying to level the playing field to improve job opportunities, access to housing, and a chance to live in a community instead of being warehoused in an institution. Our mission is to create a community that understands the impact of mental illness and that will help us raise awareness, reduce that stigma that is associated with having a mental illness, and make some positive changes in our mental health system. Our primary goal, again, is advocacy. We have felt the sting of stigma and discrimination against our loved ones. That's why we fight for justice, equity, and opportunity, especially for those who are living with some mental health challenges. We provide our volunteers and our leaders with the resources and the skills necessary to advocate for mental health in not only themselves, but their family members. And you can find a variety of programs that we offer that are all free to anyone looking for mental health challenges. We lead the conversation. We know what it's like. And so we understand what our loved one is going through. We understand the importance of education, support, and advocacy. And so that's why we even lead the nation in calling for more research and better treatment. Our public awareness events that we offer, our activities are all designed so individuals can have a better understanding of not only what's going on with them, but with their loved one. We listen. We've been there. We understand. That's why we can inspire others. We want our community to be able to be compassionate and caring. We have a toll-free helpline that is designed for anyone who needs help and resources. We support individuals wherever they might be. We give people direction. We provide them with information and resources to help them move forward in their lives and in their family relationship. Our education classes provide the information that families need to heal and move forward. They are for family members. They're for individuals, school staff, professionals, anyone who wants to better understand someone who's living with some mental health challenges. And so again, the following, I'm going to give you just a kind of brief synopsis because I think I only have like 10 minutes left, a brief synopsis of all the programs that we have. And again, they're all free to anyone who needs help. And so our Family to Family program is an 8-week program for family members who better want to, it's moving forward, who want to understand their loved one and what they're going through. It is 8 weeks of education, information, resources, and opportunities for family members to interact with others who are facing the same challenges that they are facing. It's an 8-week class offered only in the fall and spring. Our next class is going to be offered beginning Wednesday, September the 17th. It's 6 to 8 o'clock via Zoom. Our family support group is offered on a bi-weekly basis I apologize, this screen is moving forward when I'm not touching. It's the first and second Tuesday from 6 to 7:30 via Zoom, and an in-person class support group that is offered once a month on Wednesdays from 6 to 7:30. And again, this is an opportunity for family members to just come together and just talk about the challenges and experiences that they are having with their loved one. So get some recommendations, consideration, just to get some support for other individuals who are experiencing those same type of challenges. Our peer-to-peer is an 8-week education program for individuals who are living with mental health challenges. Again, it is an opportunity for them to learn about their own mental health challenges. So it talks about the brain, the conditions, the importance of education, eating right, having a goal, having some passion. It takes them through a whole synopsis and overview of what it's like and what you must do to take care of yourself to get better. And so again, that is an 8-week class taught by individuals who have lived experiences for individuals, anyone who's looking to make better lives for themselves. Our Connection Recovery Support Group is for individuals who want to talk to others who are living with some mental health challenges, and we offer those on a regular basis every Wednesday in person and every Thursday via Zoom. Those numbers are available, and I can send this PowerPoint to anyone who wants it, but those are available to anyone who needs help, individuals, peers living with mental health challenges, both in person and Zoom meetings. Our Spanish classes are for family members and for individuals who are living with some mental health challenges. Again, those are offered on Wednesdays for individuals and on Tuesdays, every Tuesday at 9 o'clock. And again, anyone who wants access to that, they can email me and I will send them the Zoom link for those Spanish meetings. And I apologize, my screen is moving forward before I'm speaking. So here we go. Our Peers Supporting Peers is for young adults. It is every Wednesday from 8 to 9 via Zoom. Anyone who is living with some mental health challenges, they just want to talk to other young people who are experiencing some challenges. Those are offered again on a weekly basis via Zoom from 8 to 9 p.m. It's just like a check-in. They don't have to stay the entire time. It's voluntary. It is led by individuals living with some mental health challenges who can relate to themselves and to those who are attending. This is a new support group that is just starting for LGBTQ communication. It's just going community. It's going to be beginning August the 6th. It'll be from 6 to 7 p.m. via Zoom for individuals with like minds who want to have additional support for those individuals living with some challenges in our LGBTQ community. Our grief and loss support group are those individuals who are experiencing personal loss. It is once a month on Mondays from 6 to 7:30 via Zoom. Again, that Zoom link is available via an email that is sent out to anyone who is expressing need. Again, it's meeting once a month for anyone experiencing grief and loss. This is just an overview of all the support groups that we offer. Our Connection Recovery for individuals living with mental health challenges, our family support groups for family members, our Latinx for both individuals and family members, and then our young adults, LGBTQ. Again, those meetings are offered throughout the month. Family and Friends is for anyone in our community who just wants to understand anyone living with mental health challenges. It is a 90-minute presentation for anyone in the community, regardless of whether you have a loved one or just someone, a friend. You just want to better understand someone living with mental health challenges. It basically gives you an overview, diagnosis, treatment, recovery, importance of communication, how to communicate and support someone who is living with some mental health challenges. And again, it is for any community member wanting to learn more about individuals, family members, close friends who are living with mental health challenges. That 90-minute presentation is based upon individuals' request for additional information. And again, it is pre-scheduled. Homefront is for family members who have a serviceman or a woman who has experienced some challenges. It is a 6-week class that talks about, again, what they have gone through, their experiences, the challenges that their loved one may have experienced while serving in the Army or military. It is a 6-week class offered in via Zoom or in person for anyone who, any family member of a military service member or veteran. Our Basics program is a 6-week online class for caregivers or parents of children under the age of 13 who are experiencing some challenges, regardless of whether it's behavioral or mental health challenges. This program, it talks about some strategies and some problem solving that parents and caregivers can help their loved one, their child, their youth who are experiencing some mental health challenges. It is an opportunity also for family members to meet others who have loved ones who are under the age of 12 or 13, under the age of 13, who are experiencing some challenges. It is a 6-week class. Our Hearts and Mind is a wellness program designed to educate individuals about the relationship between their physical and mental health. Again, it is a 4-week program. It talks about nutrition, diet, how to manage our medication, and a variety of things to make life better for them in this wellness program. Again, that is offered per request for anyone who is looking for it. It is a 4-session class for anyone who's looking to better understand their overall well-being. NAMI in our own voice presentation is where 2 individuals come and share their stories. And it's basically taking place with our CIT, crisis intervention training, but we also do it for schools and churches, and anyone who requests. Individuals will share their stories, their personal journeys, their ups and downs, and answer any questions that individuals have about what it's like to have be living with some mental health challenges. The presentation is usually about an hour. 45 minutes to hour presentation, and it's done via request. Ending the Silence is a 90-minute presentation, or I apologize, it's a 60-minute presentation for our students, junior high and high school students, so they can better understand mental wellness, how to look for the signs and symptoms of someone who's living with some mental health challenges, and what they can do as teenagers to help their loved one or their friend who is living with some mental health challenges. It is also available upon request, offered to students, staff, and families. This is just an overview of that same program. NAMI on campus. We have currently 8 local NAMI on campuses here in Bakersfield, and 3 in Delano, the Shafter, and we're working on getting one in the Arvin and Taft area. NAMI on campus is a student-led club where students advocate, promote awareness on their campus just to have a safe and secure environment. And so again, it is offered for any school. We have one at Cal State, a club at Cal State, and also at Bakersfield College. Again, it is student-led. Time to Sign is a local program that we offer for our children, our toddlers at the library. We do it on the 1st and 2nd, 2 Mondays each month from 10:30 to 11:30. Basically for our little kids who don't have words to speak. So we're teaching them the basic signs of how to feel well, how to communicate, and how to interact with their parents and other peers. I think my time is just about out, but Peer Support Specialist is a certification program for individuals who have their high school diploma who want to become trained peer support specialists. It is an online training program offered to anyone, again, who have their high school diploma and who want to be able to share their story to make life better for someone else, become a peer support specialist. This is a program that we just started in January, the importance of being ready for any disaster. It is a 1-hour presentation just to prepare individuals, to give them that 5 simple steps of how to be prepared for any disaster. In our local Bakersfield, we do have a food pantry and medication assistance program for individuals who cannot afford food, or they need assistance with their co-payment for their prescription medication. This is just some upcoming events. We do have a Sharing to Hope Together forum that's scheduled for Thursday, September the 25th. It is open to anyone who wants to come, 5:30 to 7:30 on Thursday, in honor of Suicide Prevention Awareness Month. Our walk is scheduled for Saturday, October the 18th. It's a free event. Anyone and everyone is welcome. You do have to register. Please register. And our purpose is to promote awareness, to raise funds, and to build our community. This is how we are able to make sure that all of our programs are free through our NAMI Walks fundraising event. Our kickoff event for NAMI Walks is August the 5th. And then anyone who wants to become part of NAMI, it is open to any membership. And then my last statement about who we are and what we do. Care. It's just a simple 4-letter word, but a powerful way to change the lives of people impacted by mental health condition. It's an action, It's a feeling and it's a gift that we give ourselves and to each other. People feel love when someone cares. People feel heard when someone cares. People recover when someone cares. And society changes when people care. Our entire system changes when people care. And so we here at NAMI Kern County, we're here to make a difference in the lives of people, our local communities, our entire community. And so thank you. Thank you for the opportunity. Thank you for allowing me to share. And now I am open for any questions that you may have.
I have a question on the one on campus. I'm Corey Hansen. I'm the principal at the middle school. Does somebody come out and like train an adult to run that?
Are you talking about the Ending the Silence presentation?
The one that said it was a club, NAMI on campus.
Oh, the NAMI club on campus. Okay, so that is for any school. We both have been offering it to our high school, but would be welcome to offer it to your school. And there is just an online training for any of the advisors and student leadership that they do have to attend. If you want more information, please connect with me. My email, the NAMI Kern at yahoo.com, or the Sharon Wolfo. Just send me an email and I can get you connected. We can get started with that part of it, okay? For junior high school.
Thank you.
Yes. Any other questions? I know I went through that kind of fast, but you can always email, you can always call me if you have any other questions.
Sharon, thank you. I'm really happy to have connected with you so that you could come here to share this information. It was very useful. I was wondering if you or somebody who would be able to connect me with maybe flyers or brochures that I might be able to have here in our office.
Okay, that would be me, and I can connect with you.
All right, I will reach out then. Thank you so much. Did anyone else have any questions for Sharon?
And again, my telephone number is there. You can call me or email me anytime.
All right. Well,
Sharon, I'm sorry, I just wanted to ask Sharon if you could please share your deck with me that you just presented.
Yes, I can send you that PowerPoint, okay?
Thank you so much.
all right. Well, thank you very much. With that being said, now we have Lisette Navarro, who is going to be sharing with us from Project Food Box. So thank you very much for coming. Are you ready, Lisette?
I'm ready. Thank you. Thank you, everyone, for the wonderful opportunity. Let me go ahead and share my screen. And Sharon, that was a great presentation with wonderful information. I will definitely be reaching out to you. I have a family member, so thank you, Sharon. Let me go ahead and share my screen with everyone. Awesome. We are ready. So my name is Lisette Navarro, and I am a community outreach specialist for Kern County, because it was only myself for a moment, but we have someone else that's on board. We do have an events coordinator that has been visiting. I think it's once a week, right, Jessica? Or every other week, the Family Resource Center, which is great because that's where we're capturing some of our enrollments out there. And I think it's a definite benefit that we want to get out there. So we are Project Food Box, and we are under Sunterra Produce. That's our parent company. And we are a medically tailored meal program. And what is a medically tailored meal program? It's meals that are curated by registered dietitians for those that have diagnoses, and it helps manage their chronic conditions. So let me go ahead and tell you, we just launched in 2022. So we just reached our 2-year anniversary in November. So we're pretty happy about that. But initially we kind of dabbled in this in 2018. It started in 2017, but finalized in 2022. So we are 18 to 20 pounds of nutrition dense produce that is delivered to the member's doorstep weekly, and it can last for up to 6 months, but it is broken into two 12-week increments. So at the 12-week mark, the members will usually receive a text message, an email, or a phone call asking them to renew their referral so that they can continue to receive the rest of their benefits. So this is for Medi-Cal members that have Kern Family Health and Anthem Blue Cross residing in Kern County, but we're not only in Kern County, we're in others. I believe we're in 27 counties in California, but we're focusing on Kern right now. Kern Family Health has restricted their eligibility requirements, and they have also requested that the referrals go in through just strictly through the physician's office. So there was a time where we were able to do those referrals for them, or we were able to send the link out, and anyone can do them. Any of our community-based organizations could do the referrals, or the members could self-attest. At this time, only Anthem Blue Cross is able to do that. So Kern Family Health has that restriction at this time. And the onboarding process is fairly quick. It's 1 to 3 weeks. Sometimes it can take a little longer, and that's just because of the hit and miss for whatever reason. If the registered dietitian needs to get in contact with the member and has extra questions and they're not able to, it just takes longer. It's usually playing phone tag that makes it take longer than that 1 to 3 weeks. So just a little background about Sunterra Produce. Sunterra Produce has been in the business for over 20 years. So as you see, there are growers, packers, and shippers of fresh produce since 2000. That is the direct mission when our CEO started his company, was to farm quality produce. And it's all a science. So the one great thing is I was able to, when I first started working here, I was able to go on a field trip and I was able to see the farm. I was able to see the factory, and they take quality, they take pride and care in the quality of the ground. And people don't think about that. Like, what? It's a science down to the soil, and it's pretty amazing seeing it. It was like Charlie and the Chocolate Factory, but it was actually Steve and the Farming Factory. We have participated in the USDA's Farmers to Families Food Box program, and that's kind of how we stumbled upon becoming a medically tailored meal program. During 2020, when COVID hit, everything was crazy. I'll say that people did not know how to handle that time. I remember, I think I was only twice in the office during the week. We were only allowed two to the office during that time. Well, during that time for farmers, they had to figure out what are they doing with this produce that's going to waste, right? A lot of it was going to waste. So because of this USDA Farmers to Families Food Box program, we were able to provide this gentleman here, his name is Blackfeather, this gentleman on the right, we're able to provide his community with 250,000 boxes, which helped them immensely because during that time they were very decimated. They were in need of food, and we were able to help. During that delivery, Times Magazine captured this picture, this exact picture that we're looking at, and they put it on their front page. Cal Optima out of Orange County contacted Steve, our CEO, and asked him, hey, do you want to be a part of the medically tailored meal program? And we've been doing it ever since. So now we're mission driven. Our mission has changed. So it's not just, okay, we want quality produce, right? It's now changed to where we want to provide nutrition dense produce to members so that they can manage their chronic disease. We do partner with multi-generational family farms, which is pretty amazing. So across California, we work with the small farmers. So we keep the farmers farming, which is pretty amazing, versus letting it just be monopolized over a big company. So we are working with the small farms. We are also USDA inspected. And one thing that's not on here, we are all HIPAA compliant. So if for whatever reason we do come across, because we usually don't deal with members' information, but if we do come across it, it will be kept safe. So as I had mentioned that we kind of like dabbled in, doing the medically tailored meal program in 2017 and 2018, but it officially piloted in 2018 in 8 different counties. And during that time, they were able to collect the data to see that it did address poor health outcomes. It supports complex care needs. It supports specialized dietary requirements. It manages chronic conditions and has reduced hospitalizations. So we are under the CalAIM initiative, and that is the goal, is to reduce visits to the emergency room and to urgent care. And really what it boils down to is we are what we eat. You know, we have to go back to basics and eat our vitamins from our food, get the vitamins from the food that we eat versus just taking a pill, which are vitamins. You have to always go back and think, how did they do it back in the day? You know, when they didn't have pills and medicine, food was our medicine. This is the eligibility criteria. So in order to qualify, individuals will have to have, you know, chronic conditions, right? One, they have to have Medi-Cal, either Kern Family Health or Anthem Blue Cross, and then they'd have to have these criteria. So they'd have to have diabetes, cardiovascular disorders, congestive heart failure, stroke, chronic lung disorders, HIV, cancer, gestational diabetes, or other high-risk perinatal conditions, and chronic or disabling mental behavioral health disorders. However, let me take that back, because with Kern Family Health, they have restricted their eligibility criteria. They are no longer at this moment accepting mental and behavioral health disorders as a qualifying conditions. Individuals being discharged from the hospital or skilled nursing facility or at higher risk of hospitalization or nursing facility placement are also eligible, or individuals with extensive care coordination needs. But if you look at how, you know, how mental and behavioral health disorder, that is a qualifying condition, was with Kern Family Health, but right now it's just due to the fact that they can't take referrals. They've been flooded, but Anthem is open to this. And it has to make you think. Food affects our mental and behavioral health. So it's huge. It's all related to gut health, and it makes people think, you know, I always like to point that out. Hey, we are what we eat. It's true. I remember being told this as a kid. We are what we eat, and it is the realest thing that I can tell you now, because in working in this industry, we are able to come across so many people that are in need, and a lot of it is food. It's food related. It's caused by the food that we eat. So these are the 6 different options that we have. This is really what our boxes look like. Only thing is that our boxes are not brown anymore. They're green, and they have like a silver lining to insulate it. But we have a diabetes option. Well, obviously the registered dietitian will assess the member for what's the best fit, right? So we have a diabetes box, the cardiac box, renal, cancer, immune support, low sodium, and gluten-free. And always when I get to the gluten-free, I always bring up the fact that produce doesn't have gluten, but the table shelf items do. So we do provide 1 table shelf item per box weekly. And as you see, it's a quinoa. We do provide brown rice, peanut butter, wheat pasta, and when, you know, the gluten-free boxes, obviously they will be gluten-free. But who knows how to make Brussels sprouts? I always like to look at this, and I just recently taught my kids how to do it, and we weren't eating veggies the way that we should have been, and now we are, because I do get to receive a box weekly. We learned how to season these up and pan sear them. And I'm going to tell you, my kids love the vegetables. It's just the way that you prepare it. And let me go ahead and add that we do send recipes in each box. And this is just the step-by-step on how to onboard with Project Food Box to start receiving a box. So step 1, providers refer their clients or members, right? So that's mainly for Kern Family Health. It has to come through the physician's office or their ECM program. For Anthem, members can self-refer, and they can do it off of the QR code, or they can call in through the number, or they can do on-site enrollments wherever they end up finding our events coordinator. 2, the client is then onboarded by our member success team to gather all delivery and contact information. So say, for instance, the member has a special request. Hey, can you place the box next to my garage? Or can you put it on the chair next to the door? I've been asked, can the box be placed on top of a car because they have dogs in the yard? We will honor the request if it's something that's doable. 3, the client is virtually assessed by a registered dietitian to determine the most suitable box solution. 4, our experienced produce packing team fulfills each unique grocery box with precision and care. And I'll tell you that they have a box making machine. Before they used to make these boxes by hand, but now they have a machine that does it. And then finally, 5, a medically tailored grocery box uniquely designed for the client is delivered to their home weekly. And, you know, we don't get this nice little van. They have this van out there in Brawley, California, but we get a regular like Amazon van. The same way the members can track their box, the same way that that someone can track an Amazon package, they can now track their food box as well. So I think that's pretty awesome. And one fun fact to throw out there before I'm done, our lettuce, if you go to In-N-Out and you order a protein burger, that's our lettuce. Our CEO likes to be known as the lettuce king. And that's it, everyone. It's just really, how can we partner? How can we get this out to the members? Like I had mentioned, we are under CalAIM, and that initiative is ending December 2026. So when I did find that date out, I had forgotten about it. And then I was reminded and I was like, wow, I have I gained that sense of urgency to get this out to the members before it no longer exists, because it is a Medi-Cal benefit. It can easily become privatized and then our members will lose out. So I really do want to get this out to those that qualify, because there are testimonials where it works. It works. It helps them. I have a member that had this diabetes that was very uncontrollable. She couldn't walk around without her insulin. She was falling asleep. And I was like, is it that serious? It just so happened that she's a friend's daughter, right? And I'm like, your diabetes is that bad? And she's like, yeah, I have to have my insulin. Okay, well, let me sign you up for Project Food Box. And guess what? She took it serious when she received her box. She integrated the produce into her diet, and now she's managing her diabetes with the A1C of 5.7. So she's able to live life, you know, and not have to be held to that insulin, you know, constantly having to inject herself with that. So it really does work. And if you guys have any ideas, please feel free, reach out to me, and let's partner so that we can get this out to the members. Thank you so much. Does anyone have any questions?
I do. Can you hear me?
Yes, I can hear you.
Okay. So, out of my experience now, my mom recently signed up with you guys,
Maria,
and
I can slightly hear you.
can you hear me now?
Yes.
Okay. My mom signed up, and recently she got a letter from Kern family saying she didn't qualify because her diabetes wasn't out of control and her blood pressure wasn't out of control.
So, and that's part of the restrictions that have been implemented. And they have been flooded with so many referrals, so that they had to put in the restrictions so that they can get the ones that needed the most, to get it to the ones that needed the most first. I'm hopeful that they will open up, you know, after they get through those members that are in line. But yes, a lot of our members currently are receiving those letters that they don't qualify. So say, for instance, if your mom goes to her physician and her physician he can advocate for her. So if the physician believes like, hey, you know what, she can truly benefit from receiving a box, the physician can submit the referral for her.
So go again through the physician then?
Yes. So through her primary care physician.
Okay, and they should know how to do it?
Definitely. Yeah. And well, and that's another thing too, is like we're running into some of the providers don't know how to do the referrals. So we've been doing, what is it called? Repair is going in and trying to show them how, and we've been having these meetings.
Yeah.
And it's like, let's do the
Because
step by step.
I know I had another client and they said they brought it up to the doctor and the doctor was like, what's that?
Yeah, it's a surprise for everyone, because you know, they were able to do the referrals off of our form link, and now the doctors are being asked, hey, we need you to do these referrals. And that's creating administrative burden, because a lot of doctors they're working and they don't have time to do these small things, but these small things really do matter. So the medical assistants can also do these referrals as well, and then the doctor just has to sign off for it.
Okay, sounds good. Thank you.
Thank you.
I have a question. Is there a way to take the referral into the office with us so that we can have the doctor sign it there?
I can definitely ask that question. Yesterday, I had a meeting at one of the clinics and I did see the actual like paper referral. So I need to get in contact with Kern Family Health. And then I'll follow up with you to see. And it's kind of a question for everyone because that would be wonderful if we could do that.
Because I have a meeting in the beginning of the school year with families on Medi-Cal to see what needs they have, like dental and eye. So that would be great if I had the referral and could tell them when they go in for their beginning of school appointment or their physical to get that set up.
Yes, perfect. And I have your email, so I'll follow up with you.
Thank you.
Thank you. And remember everyone for Anthem, and I know that Anthem is like, I think it's 19% of Kern County. Kern Family Health has 80% of our population, right? Is on Kern Family Health, and the rest is 19. And Kaiser has, I think, 1% under Medi-Cal. But it's open. It's open for Anthem and it's open for Kaiser. Kern Family Health is the one that had to restrict just because they were inundated with so many referrals.
What, I have another question. What
Mhm.
about clients that have straight Medi-Cal?
So they'd have to have a MCP being either Kern Family. They have to choose. And they can't just have straight Medi-Cal.
Because my brother, he has straight Medi-Cal because he has brain cancer. So would that make him not eligible then?
That would make him not eligible. Is there a reason why he doesn't want to choose?
Yeah, he gets seen in Cedars and Beverly Hills, and they don't take Kern Family or Anthem.
Okay,
And
that
that's where
makes
they do the
sense.
treatment
He
for the
can
cancer.
he can ask
That this way
through.
they cover fully.
Yes, but and I'm gonna tell you that every insurance has some form of medically tailored meal program. So get in contact, have him contact Medi-Cal to see what they can offer him because he's definitely has he meets the eligibility criteria, you know, with his diagnoses. So he should get some type of medically tailored meal.
Okay, thank you.
Mhm. Thank
I
you so
have a
much, everyone.
question.
Okay, go ahead.
I did have a couple of clients here in our office who expressed some concern um, with them being undocumented and, seeing everything that has been going on. They seem to be a little bit worried about them, signing up and how that could possibly affect them. Do you have any insight?
I can definitely give you some insight. We do not share our information with anyone, so our members can feel safe. I know that the political climate is not safe for everyone, right? I don't feel safe, and I was born here in the United States, but the members that do sign up with us can feel safe. That will definitely not be an issue because we do not share our information.
Thank you.
Oh, and one more thing to add to that, it does not affect their EBT. So a lot of members will, they ask like, will it affect my EBT? It does not affect their EBT. So they can get, this is another source. It's like, technically it's a prescription. So it definitely won't affect them. So let's get this out there to all those that qualify.
Thank you.
You're welcome.
Lizette,
Any
I
other
want you to
questions?
know that, oh, I apologize. Lizette, I want you to know that one of my members is in that program that you have, and she has been faithful about using those recipes that come with that. She says they're eating a lot healthier. So thank you. Yes.
That's wonderful. Thank you
Yeah.
for that. That's awesome.
I have a family member as well that has gotten some boxes from the from the Project Food Box, and I was really impressed with the box they received. It was really good food, and it wasn't, old. It was very fresh, and it was a good amount, So it's definitely a great program for those who qualify.
Yeah, and the 18 to 20 pounds, it ends up being a lot, and I don't want it to spoil because the quality produce is expensive, right? So we like to Sunterra sends out the food to Albertsons, Trader Joe's. Well, guess what? I don't shop there because it's too expensive. I shop at Food Max. I shop at Foodsco. So there is a difference in the quality. And when I do see the produce, I don't want it to spoil. So what I do is what we're not going to eat, I share. My neighbors across the street, they're enjoying some of the food from our food box as well, just because I don't want it to spoil. And it is a lot.
It is. Well, thank you, Lisette, for sharing. Was there anyone else who had any other questions for her before we start wrapping this up?
Thank you, everyone.
Thank you, Lisette. Well, we're about at the end here. I wanted to give those of you who are here an opportunity, if you had anything you wanted to share, any events you have coming up, any flyers you wanted to put into the chat, please feel free. Did anyone have anything they wanted to share?
Schools,
Go
sorry.
ahead. Sorry, go ahead. No, go ahead.
School starting in August, I don't know, 14th or something ridiculous, but if we could just share around the community that anybody that's in need can contact the district office, because my office is completely torn apart and we have no phones, but for backpacks or whatever. And then school clothes, I took a group shopping already, but we have some funds. And then also that they'll receive all their information, because I know everybody keeps putting on Facebook and asking, but they'll receive all their information for back to school about a week before in the mail, and then we'll try to, of course, post something on social media.
Hi, I'm Jisa with Books in the Woods. So we're from Pine Mountain Club, but we put on a book fair last year, and this year we've created several programs in partnership with the Fraser Branch Library. We received a grant of $5,000, and we're using that money to create something called Young Voices Read, and we're kicking it off at the beginning of September. I'll drop the flyer in the chat in just a minute. Basically, we're providing 125 students with, each of them gets 3 curated books based on their reading level, what interests them, and we're working with independent publishers around the country and in Canada who do high-low reading, who do any type of neurodivergent type books that are helpful for kids. And we're kicking it off, and we have a whole survey that parents can fill out for each student, and then we'll be able to curate books for the kids to get them interested and get them reading. And I'll go ahead and drop that flyer there for everybody to look at.
Thank you. Thank you for sharing that. Well, when it comes to us here at the Family Resource Center, we have a few things that are going on here. We do have a workshop that's coming up here. It's a parent workshop. It's coming up on July 23rd. Our community advocate, Maria, she's going to be the one hosting this. It is going to be on growth mindset for kids, and we are going to be actually having it during our children's circle hour that we have on Wednesdays at 11 a.m. For this workshop. So any parents or caregivers or anybody is invited, really. So if you know anyone in the area who could benefit from, the education, please send them our way, have them give us a call. Anyone's able to come. But yes, it's going to be July 23rd at 11 a.m. here at the Resource Center. Like I mentioned, we also have our children's circle that we have going on every Wednesday. Because it has gotten warmer, we have moved it to the park here in Fraser Park. It's an hour-long, time for children, typically 0 to 5, to get together and socialize, learn some skills. We also have walk and talk that's going on. We normally have a coffee chat during the colder months, but for the warmer months, we do walk and talk, and that's where we also meet up at the park with parents or caregivers and just kind of get together, take a walk, and talk. We are hoping to do a back to school distribution as well here at the Resource Center. We're accepting any donations of school supplies. So if you or someone you know who may be interested in donating to us for that, we would definitely appreciate it. We'll probably be doing that closer to, I think it's going to be the week before school starts. Corey mentioned that's August 14th. I think you're right. It's not the 13th, 14th. And then our next collaborative, it is, like I mentioned earlier, it will be in person. It is scheduled for September 18th. It will be at 10 a.m. as usual. And like I said, it does look like it will be at the high school here in town. But if that changes, I'll definitely let you know. But I think that's about it that's going on here. So we can wrap this up. Thank you all so much